Shah, who's the Director Sales, National and International Market, eClinicalWorks, to please join us on stage and give his corporate presentation. eClinicalWorks is a silver partner, so I hand over it to Mr. Aakash.
We're having a fantastic show organized by eLets and the team, so very glad that we got the opportunity and we are here right now. Getting all the dignitaries under one stage is not really possible, so thank you so much. We are eClinicalWorks, the #1 ambulatory company coming from US with 6 offices in US, UK, Dubai, and 3 offices, Ahmedabad, Mumbai, and Bangalore in India. And we'll talk about, since morning everyone is talking about how can we improve the healthcare, not just in Rajasthan, but in other states of India. And we'll talk about how you can deploy softwares, how you can get more transparency to the patient, reduce the cost, and help basically improve overall healthcare in the country. So the first step that we always tell every hospital when they want to go digital or start deploying software is ensuring that you work with a company who has a vision. And we as eClinicalWorks have been doing healthcare business since the last 20 plus years. Now we have products which are not just hospital information systems, they are also OPD, ambulatory electronic medical records. We work towards engaging the patients, giving them more satisfaction, where they just not walk in and have a word with the doctor, but there's also continuous follow-ups from the hospital side. And most importantly, you can also start doing population health. What is so important about hospital information system? Because everyone is talking about, we need to have a software, we need to have, some way of connecting different departments in our hospitals. And this is what it is. You want to ensure that you have your patient and the bed management, your billing, pharmacy, radiology, laboratory, everything connected on one single platform. And if it is not connected on a single platform, then trust me, it is not deployment of the right software. This is what we do. We have 70,000 hospitals across 40 countries. I'll talk in detail about who our customers are. Your software, at the end of the day, should be able to give you right revenue numbers, because every hospital, if it's not profitable, the software is not working for them. So it's not just reduction of the errors. At the end of the day, you want to have complete control over what reports you can run to increase the revenue. And this is what we do, and the software has it. The software should not just be compatible on a laptop or a desktop. It should also be compatible and basically be working on any platform agnostic, basically iOS, Android, or a Windows. Our software works on all of these platforms flawlessly. How do you engage a patient? We understand that there are technical challenges where there's not internet everywhere, but at the same time in the urban areas, you want to ensure that with India, using or adopting the mobile technology fastest compared to any other country in the world, you still want to give them a patient portal that gives them visibility of checking not just their lab records, but at the same time, they can do everything on the portal, which is most importantly, communicating with the hospital. And then finally, give them the ability and capability of doing all of this directly on the mobile application. And not just look at the lab records. What we've done differently as a company is we integrate every device and every equipment that you have in the hospital infrastructure. And all those devices will keep on continuously communicating with the mobile device. And the stats are sent automatically to the doctor, who now knows that my patient is active. Maybe certain dosage of medication can be reduced down. So the communication to the patient is going to be the next key thing for any hospital. It is not just a patient who comes to the hospital, but making sure that you are in touch with the patient and you care for the health of the patient is going to be the next important thing for any hospital, either in the urban cities or in the tier 2 and tier 3 cities. You should also have a kiosk where the patient basically just comes with a barcode scanner and scans their mobile phone at the kiosk machine, and the doctor inside knows that there's a patient waiting outside for me in the registration area. Everyone is talking about telemedicine. eClinicalWorks has done something different over here where a doctor can chart the patient's history real time where they can have a quick synopsis on the left-hand side of the screen of all their previous visits, and on the right-hand side, they can directly do a telemed with a doctor. Of course, you need the internet, but there's a set of questions that you can give to the patients. They need to fill it out on the portal before they join the telehealth or the telemedicine platform. The technology at any given point of time should be available on the cloud, which is what we normally call it as anytime, anywhere access, and it should be platform agnostic. Only then you have a true software solution for the hospital. Of course, everyone talks about whether we want to go cloud, should we keep local hosting. For India, we have 90 plus hospitals that we have implemented in less than 2 years, and our common directive to every hospital is that you should go on local hosting first, because one of the main challenges that every hospital faces right now is training the manpower, and that is where we as an MNC invest. Go on cloud once you have more confidence on your staff using the software. So who we are eClinicalWorks, a private company with more than $1 billion in revenue, with more than 70,000 hospitals across 40 countries. We have now seen success in the West. We have already seen success in India. We are here to come and stay for a very long time and participate in different summits and government projects, which is something we are doing right now already. Just a quick view on where we are coming from, and where our customers are right now. Now, these numbers are very significant because we service more than 70% of the US's population, which is basically more than 200 million patient data, which is stored on our private cloud. We have 115,000 providers, doctors who use our platform at a given point of time. That's 200 million patients across all the 50 states. These are some of our notable customers, where you can see the Hospital Corporation of America. We also have the New York City Department of Health and many other bigger hospitals who are already using our products. One of the unique things that we are doing with the hospitals who have started using our solutions is basically give them a direct access to provider communication. What that basically means is the second opinion, which always used to be a phone call to your relative in the West, is now going to be solved on a unique platform with a company like ours who already have 115,000 providers participating in the second opinion platform with us. In India, we've started selling our software since the last 2+ years. We have hospitals anywhere ranging from 50 beds to 2,000 beds. Some of our hospital names, as you can see on the presentation. And we have right now customers in more than 14 states in India. This is what has been our motto since we started in 1999. We take care of each and every of our customers. More than 10,000 employees worldwide, 4,500 employees just in India, in Ahmedabad, Mumbai, and Bangalore, which is why we say we have the right manpower. And even if we get 100 hospitals tonight, we have the manpower and the experienced people to implement those hospitals. At the end of the day, the goal of the company has been very simple. We want to take active participation in India and in Asia Pacific. We have already seen the success, and most importantly, improve the quality of healthcare, reduce the error, and help in the patient satisfaction in a long run, making sure that patient or the end customer has more transparency towards their healthcare. Thank you very much. We have a small AV that we wanted to play, and after that, I can take a couple of questions if there's any, or go to the panel discussion. Can we have the AV, please? Sure, ma'am. We just want to run the AV. Yes, we are compliant with all the state laws.
Who are we? Depending on your perspective, we are electronic medical records, patient engagement, revenue cycle management, or population health. But who are we? Depending on your perspective, we are electronic medical records, patient engagement, revenue cycle management, or population health. But we're really much more. And that is the definition and the magic of synergy, the creation of a whole that is greater than the sum of its parts. We are a healthcare information technology company. We are a global company with offices in the US, London, and India. We have 9 data centers across the country, so your data must only travel on the shortest path possible. This ensures increased reliability, scalability, greater uptime, and consistent high-speed access. Our network is private and secure. This means your data is your data. We are healthcare, tools that improve access to quality, affordable care, that make the delivery of care safe, measurable, and effective, that help doctors realize a positive return on their investment, and that improve the overall health of our citizens. We are information that is both powerful and personal. Powerful enough to manage the health of our largest cities, and personal, too, providing a unique health record for the more than 200 million patients who have their medical record in eClinicalWorks. We are technology that is always on and always available when and where you need it. Technology that is designed to be used to improve the health of individual patients, to improve the accuracy and efficiency of healthcare providers, and to reduce the cost of healthcare for all of us. We are eClinicalWorks, delivering healthcare information technology solutions for today and tomorrow. It is who we are. It is what we do. Every day, working with you, improving healthcare together.
We at eClinicalWorks are dreamers. We see dreams that don't let us sleep. These are dreams that are going to continue to make newer products and solutions. We're going to take our customers along with us in that journey to build the bridges of care between the providers and the patients.
Thank you very much.
Thank you, Aakash. I would request Mr. George Kuruvela, Chairman and Managing Director, Broadcast Engineering Consultants India Limited, to please come on stage and give a speaker memento to Aakash. Please. A huge round of applause for Aakash and Mr. George, please. And the eClinicalWorks stall is right outside, so if you have any questions, please, you can meet Aakash or his team member over there.